I rise briefly to speak to Amendment number 43 standing in my name on the order paper. And I know it's late, but my purpose here is to probe whether the government really understands and appreciates the impact, damage and hurt these national insurance proposals will visit upon councils, those who work with them to deliver essential services, and of course the users of those services, in many cases the most vulnerable in society. Now, my Lords, since the Great Reform Act of 1832, local authorities have been an integral part of our nation. Joseph Chamberlain unleashed the powers of municipal entrepreneurialism in the 1800s to bring gas and clean water to the growing metropolis of Birmingham. Councils sweep the streets, they collect the bins, they run parks, they issue planning permissions and curate the conditions to build the national economy, one local economy at a time. And, my Lords, I am a councillor, and for the last 14 years I've led local government finance for Conservative councillors at the Local Government Association. I've seen it all. My noble friend Lord Pickles once said there are only two people who really understand local government finance, and I'm not saying I'm one of those experts, but I am one of the small number of people who really does more than most to celebrate the 140 things that councils do to make a civil society for every family and every street and every neighbourhood every day. And that's why I know that councils' finances in England are under pressure like never before. Reductions in grant funding, increases in the scale and complexity of service demand, and the recent spike in inflation and wage costs have created the perfect storm for town halls. And the fundamental challenge facing the sector is that cost and demand pressures are rising faster than funding. Whilst inflation has fallen steadily since the peak, significant cost and demand pressures remain in the system. In essence, council revenues tend to grow linearly with the growth in the economy, but lately costs have grown geometrically, and there comes a point where the lines of income and demand diverge so much that the gap becomes unbridgeable. Now, some of the reasons for this geometric growth have been demographic. As society ages, demand increases disproportionately. Some of them have been counter-cyclical. As the economy stutters, demand for homelessness, for example, increases, and there have been some consequences of changes elsewhere in the state. Well-meaning changes of the DWP, for example, have driven the council's second-order spend on home-to-school transport up by 62.7% in the 5 years to 2024. And, of course, the COVID hangover has made things worse. We've already reached the moment where the gap has to be bridged between income and expenditure has become unbridgeable, and that's before the impact of national insurance on councils and their tied contractors, which is the subject of my amendment. Now, this isn't a case of a Tory crying wolf. Just last week, the MHCLG announced that in the financial year 25-26, next year, the government has agreed to provide 30 councils with support to manage financial pressures via the exceptional financial support process. For 8 of those councils, this included agreement to support in prior years. These are just the canaries in the mine. In aggregate, 3 services are responsible for 2/3 of all the cost: adult social care, children's social care, and, of course, SEND. And these pressures have seen the greatest increases. Let's get some numbers on the record, shall we? Increased cost and demand in adult social care have seen a rise of 3.7 billion, that's 18% since 2019-20. Spend on children's social care increased by 25% in real terms in the 5 years from 2019 to this year, owing to the increasing complexity of need and rising placement costs. Now, the Labour-run LGA tells me that by 26-27, these cumulative pressures will have added the cost of delivering services by 12.5% in the 2 years since last year, leaving councils facing an annual funding gap of £6.2 billion across the 2 years from 25 to 27, just to maintain services at 24 levels. Now, these pressures come on top of the fact that councils have already absorbed a 22.2% increase, real terms reduction in core spending power from 2011. And that's before the Labour had produced its reckless war on the countryside by cancelling the rural services grant. Look, this cannot carry on. There is no more fat to trim. And I want to explain why this is so serious and consequential, because we get to the nub of the matter. The additional burden of national insurance on council's own payroll is estimated to be £628 million for directly employed staff. but indirect national insurance through commissioned providers will cost the councils an extra £1.13 billion next year. So taking the 1.13 billion and the 628, we see a total financial impact of the national insurance increases on councils and their tied contractors of £1.758 billion. And having given warm words and soft soap that the cost of NIC on local authorities would be compensated for, as they might be with the health service, the reality is that there is just a one-off £515 million allocated to the sector. So let's do the arithmetic. The extra costs and the government's grant has left councils with a £1.243 billion national insurance hole before all the other pressures I have measured have been taken into account. Now, the effect on the tied contractors is important to understand, because those outside contractors put their shoulder to the wheel. They work exclusively for councils. They are an extension of the council's workforce. They are on the team. But, my lords, they can't afford to take this one for the team. And I notice he's not in his place. But it is time that the noble Lord Eatwell appreciates the magnitude of the damage visited on councils by his party. My lords, the OBR and DLUC tell us that council tax raises about £40 billion a year, and that excludes parish precepts. And we know councils have just put up council tax by between 3 and 5%. And whether it's 3 or it's 5%, the bold arithmetic is that the clear majority of last week's council tax rises that will kick in April will be passported straight to the Treasury through the national insurance tax. The vast minority of the extra money raised by council tax won't even stick to the sides and benefit in any measure local people. It means that most of the extra tax paid by council taxpayers next year won't even benefit the local taxpayers themselves. Now, and what this means, of course, is that taken together with the other cost pressures, this is dangerously squeezing out all the other activities that should be the core purpose of a council, the sort of council that Chamberlain would recognise: planning for growth, keeping the streets clean, teaching kids to swim in the local baths. My lords, the council is perpetrating a deceit on the council taxpayer. Next year's council tax rises, for the most part, aren't financing local services. Most of that money is being passported straight to the Treasury. And I really do think that the noble Lord Eatwell, who tried to stifle debate earlier this evening, should be here in his place to hear that simple truth. Put simply, this wholly new, unexpected NIC pressure fails to provide councils with the security of funding they need to reliably and effectively deliver for all their communities, and potentially worse. All of this is aggravated because the £515 million that's been allocated as some sort of sop to compensate in a small measure councils is only for 1 year, and none of it is guaranteed in any event after the comprehensive spending review, which could be another insult to injury. My lords, just thinking, and I'm conscious of the time, but it's a fantasy to think that local government reorganisation is the solution. Creating huge, remote, strategic authorities to replace the local friendly districts will aggravate this funding situation even more. Look, the work of districts still has to be done, but substituting that most efficient part of local government with mayoralties will not result in a reduction in layers of bureaucracy. There'll still be 3 layers, just bigger and more remote. And I have a warning about the profligacy of the new, larger, more remote tier of governance. My noble friend Lord Kempsell reports on his blog that the Greater Manchester Combined Authority has forked out a staggering £472,500 to fund its equality panels to advise and support and challenge Greater Manchester's political leaders on matters that cause injustice and inequality. A further £52,000 to a faith-based advisory panel, and £54,000 to the Greater Manchester Youth Combined Authority. In total, nearly £600,000, money that would keep my district council going for nearly a month. In fact, half of the new unitaries established just 3 years ago, ostensibly to save the hard-pressed council taxpayer, Cumberland and Somerset are two of the 30 authorities which are now receiving exceptional financial support. Look, council finances are under stress, but if anything, the national insurance, coupled with local government reorganisation, will cost council taxpayers even more. So my amendment seeks for the government to report on the effects of all this, and by extension, to open a conversation about compensating for the actual costs of the change. My amendment would have the effect that doorstep services that the residents value the most in cities, in market towns, new towns, the countryside, coastal communities and cathedral cities can be protected. So I'd like to ask the Minister, and I did ask him before, and he somewhat dismissively dissembled, but the issues are now even more stark. Does he accept that the LGA's updated figures are substantially correct when the direct and indirect costs of tied employment on NIC are taken into account? Does he recognise the £1.243 billion shortfall? Last time he said he didn't really want to understand those figures. He only believed figures that were calculated by the Treasury, the same people that told him that only a few hundred people were going to be affected by IHT. I'd like to ask him why local government is being treated differently to national government when assurances were given at the outset there would be equal treatment between the two. And what assessment has been made on the most vulnerable? What commitment has been made to the comprehensive spending review? And can he tell us clearly, how does allowing councils to borrow against the additional costs of financing this national insurance help meet the Chancellor's golden rules? So my amendment is classified as a probing amendment, but it's no less serious for it. Labour has quite simply lost control of the handfuls of money that councils rely on to deliver their services. And this national insurance will push them to the edge. They can't blame the Tories. This is a crisis devised in Downing Street, delivered by Marsham Street, but felt in every high street. I beg to move.
Carried away there. Amendment proposed after clause 3 insert